Valley. The coalition actually represents thousands of businesses and hundreds of thousands of employees. And so we're thankful that you're here with us this morning, grateful that you've tuned in. I did want to say that all of the chambers involved in the coalition have been working diligently, not just advocating on behalf of our region, but providing information, tools, and resources to our members and our local business communities, making sure that the best resources and most accurate information regarding COVID-19 resources is available. One organization that provides valuable information is CalChamber. CalChamber has over 14,000 business members, and they're the largest advocacy group in the state. We're honored to have Alan Zarenberg with us. He's the president and CEO of CalChamber. And we're going to be talking about 4 areas today: the COVID-19 impacts to California businesses, the state of California's response and assistance to small businesses, federal assistance, and finally, the role CalChamber and local chambers will play in the recovery process. Now, before we begin our discussion with Alan, I'd like to turn it over to Matt Mayhood. Matt is the president and CEO of the Silicon Valley Organization, also known as SVO, and he's the co-chair of the Silicon Valley Coalition of Chambers. Matt?
Great, thanks Mark, and really appreciate everybody being here today. And I want to personally thank Mark for securing today's presenter. Just a few housekeeping items. Every attendee has been muted for today's presentation, and we do that to kind of maintain some semblance of order on all of our webinars. Networking and connecting is core to our activities here at the SVO and the Gilroy Chamber and all of our chambers of commerce, and we think that's important to continue to do, even though we're at the COVID-19 shelter in place. So we love to see who's on the call. We can see many of your faces and your first names, but feel free to write your name and your company or who you represent into the chat box so everybody else can kind of see who else is on the call. Also, if you have questions that you would like us to consider during our conversation this morning here with Alan, please type that into the chat box, and Mark and I will be monitoring the chat box and trying to pull those up and make sure we address those questions. So without further ado, let me introduce today's guest. Alan Zarenberg. He is the president and CEO of the CalChamber. He has held that position for the last 22 years. Previously, he was executive vice president and head of CalChamber's legislative advocacy program. If you don't know much about the CalChamber, they focus primarily on 2 things. California state legislative issues that affect business, so that keeps them really busy in the state of California. And 2, they serve as a leading employment law expert, providing products and services that help employers comply with continually changing California state law. Alan served previously in the administrations of Governor Duke Majan and Pete Wilson. He also served in the U.S. Air Force as a captain and a flight navigator on a KC-135 jet air refueling tanker. And he holds a BS in economics from Penn State University and a JD from McGeorge School of Law. Great guy. I've known Alan for a long time during my time in Sacramento and now here. And Alan, we really appreciate you being here with us today to give us an update on everything that's going on in the CalChamber, state of California politics, and really what's going on with COVID-19. So we know it's a really difficult time for business in California, and I want to start with kind of a prompting question. Huge economic impact, everybody's feeling it across the state. What's your sense of California's economy right now, and what do you think is the economic impact short and longer term with COVID-19? And we'll start with that, and then we'll jump into some other more detailed questions.
Great. Thanks to everybody for having me on, and it's a real pleasure to be able to talk to everybody today. I want to make sure that everybody's sensitive to what's going on, and as you are. And Matt's asked me to talk about the economy here to begin with, but I think what's more important is what's the economy to you. as a business person, what's the economy to you as a chamber executive? And that's, I think, really the aspect of this that is so crucial. Can I just, can everybody hear me? All right, good. We're good. Okay, great. So we do a podcast. We used to do a podcast once a week until the crisis hit, and now we do like 3 or 4 podcasts a week. A lot dealing with HR issues. How do you deal with your people working remotely, and also bigger picture items. How's the economy look? And I've, in the last, so I'd say 2 weeks, I've interviewed 2 economists, both actually nationally known economists. Chris Thornburg from Beacon Economics, many of you have worked with him, truly a California economist, and Mark Vittner from Wells Fargo Securities at Wells Fargo. He's back in Charlotte, but he used to be based here in California, and he's an expert on small businesses. Chris said, well, we're going to have a V-shaped recovery. You know, this is going to be over, and as soon as it's over, we're going to skyrocket right back up. You know, that was maybe 3 weeks ago he said that. Mark, I did 2 weeks ago, and Mark was a little more cautious. And was not as optimistic with a strong recovery in a short period of time. So I just lay that as foundation because when you hear from me, in my opinion, we know that the experts, the economists, have differing views. I don't think we're going to have a quick recovery. I'll just tell you that. And I think one of the challenges here is the ability to have public contact. So today, going up on today's podcast, last Friday I interviewed, and it's a pretty long one, it's 30 minutes long and we cut it down. The head of science at pharma back in Washington, it used to be with the Food and Drug Administration, an expert on science. And we had a long conversation about how science is going to lead us out of this problem. And I'll say that as long as we have distancing is the only mitigation we have to reduce risk, we're not going to be able to fully recover. You know, who's impacted dramatically? Obviously, people who rely on social contact or contact among the public. You know, so it's not just Disneyland, and it's not just the beaches, and it's not just the restaurants. It's the optometrists, it's the dentists, it's people, it's the hairdressers. I do have hair today because it hasn't been cut in 5 or 6 weeks, but you know, these are a huge part of our economy that relies on the ability to have contact with people. Everybody who is in the supply chain, whether you have the hot dog stand at the ballpark, or whether or not you're at the airport, or whether or not you're the parking attendant in downtown San Diego, you're impacted whenever people can't get together. And I see this as a key component. So the governor, okay, so I was, and I'll get to this in a little bit. The governor created a task force on trying to get our economy back in operation and be successful. Before that, which I think is crucial, he created a task force on testing. And I think that really is one of the key things that is important in terms of being able to find solutions here. And if you listen to the podcast and my discussion with the doctor, which is going up today, so it's very current, you know, we focus on 3 aspects of science: testing, treatment, and immunization, or a vaccine. The vaccine, I don't think there's anybody who thinks it's going to be around before March of next year. So the question becomes, can we have testing that is ubiquitous? Can we have testing that you don't have to go to the lab for? Can we have testing where you get quick results? those are the kinds of things that are really going to be crucial in terms of being able to have better contact among the public and with our workers. And then finally, of course, as the sort of the intermediate step is treatment. And we had a good discussion, and I think this is an important aspect of it. If people do get sick, can we keep them out of the hospital? Do we have treatments out there that are going to reduce their risk for hospitalization? And so between testing and treatments, the science there, I think the quicker we can do that, the quicker we're going to have the ability to have public contact and get back to work. You know, I think one of the other aspects of it, well, is there something short of that we can do? And I think we're starting to see some counties petition the governor to be able to lift a statewide ban. So I think the governor has said in the past, I'm not going to do something more restrictive than accounting. And I know many of you in the Bay Area, Santa Clara, where the first fatality occurred back in February, you know, have had stricter requirements than the rest of the state. But the governor, when he got a request from San Luis Obispo and Placerville, he has yet to say, I'm going to lift my statewide ban. And I think this points up the dilemma here when we talk about the what's going on. And so I know there are, we'll just go through the history of regulators, and this ties back into the public health people in your county. You know, if you're an air quality regulator, your job is to regulate air quality. Your job is not to deal with the economy. Our public health officials, their job is to protect public health. Their job is not necessarily to make sure that they're not impacting the economy. They're not economists. They're public health people. How do we mitigate the pandemic? That's where the politicians come in, the elected officials, who provide that kind of leadership to eventually say, okay, is the cure proportionate to the treatment? And that's one of the questions I think our leaders are going to have to answer, and whether or not the supervisors are going to step in like they did in San Luis Obispo and said, we're working with our public health people to make things more secure. And so I asked the question, and I've asked the question of the administration this, if somebody provides the proper protocols to protect their workers, to protect their customers, why is it that they have to be required to be an essential business? So, you know, those of you, maybe you're in the grocery business who do the shopping, you know, the day after, of course, the orders were issued, whether they were county orders or in the Bay Area, which was first, or whether or not they were the state's orders that the governor issued beginning on the 19th. You know, if you went in the grocery store the next day, it was chaos. It wasn't very safe. And we've seen the grocery stores develop protocols that are trying to be more, to be more mitigation friendly towards the risk, and making sure that there are lines where people don't get too close together, to make sure that the public follows that. Some have one-way aisles. You know, they've come a long way in 4 weeks to try to be able to say distancing works because we know it works, and this is how we mitigate the risk. So if you're a furniture store, can you mitigate the risk? The same way. And so you weren't included in the essential businesses, but is there any reason why somebody can't come in to your store if they stay 6 feet away from the salesperson, or if they order something the same way you do in a grocery store? Is there a reason why they can't have the same opportunities as an essential business? I think we'll come back to the public contact. There are so many businesses that rely on contact with the public. And obviously those businesses that have been so hard hit are the ones that rely on that. So whether it be restaurants, hotels around convention centers, obviously, will we ever see conventions come back? Yes, we will, but is a year away? Those are the questions that you can't answer today. And whether or not there will be intermediate scientific improvements that help us mitigate the risk other than just distancing until we get a vaccine. Matt?
Mark, you want to jump in, or you want me?
No, please go ahead. We've got a series of questions. Go ahead and jump in with those.
Yeah, so Alan, appreciate the opening comment. So obviously we have a whole bunch of chambers of commerce on the phone here today, and then we have some businesses as well. But, you know, obviously small businesses are the backbone of many of our organizations. Do you see the shelter in place? You know, we have the date coming up, May 3rd, May 4th. Do you see a shelter in place order going longer than May 4th? Or do you see like some businesses being able to open up? Because honestly, we're hearing from small businesses that they can't hang on. And, you know, PPP is coming too late. It's just not hitting. And so what do you recommend that, you know, what are we going to tell our members and tell these small businesses that are really struggling right now? And
Sure.
What do you see?
Okay, absolutely. So let me step back a minute, because I think we have to put PPP in context in the whole federal aspect of this, and whether or not you think the federal administration waited too late to act or didn't do enough on testing or whatever. You know, I think if back in February, we'll take February as a good example of when we know now the first death occurred in Santa Clara. If Congress and the president got together and said, you know, we're going to shut everybody down in a month, let's put a PPP program on the books, let's appropriate $2.2 trillion and say you can apply for loans and you have a month to do it, and then we're going to shut you down. Congress never would have acted, never would have appropriated $2.2 trillion, because they didn't realize the extent of the crisis, regardless of whether Congress did or the federal government did, or you know, whether or not the health officials in the Bay Area recognized how severe it was. Although there are people, obviously, in hindsight that have said, we knew this was coming based on what happened in China or in other parts of the globe. And it was just a matter of time. But you never would have had Congress appropriating $2.2 trillion. So it happened because the economy was shut down. And I think that's the difficulty that we all face, and how do we deal with it? Because the money has not gone out into businesses' pockets. So when the PPP was announced, so I'm just going to make another pitch for our podcast. I used to be on a bank board. I interviewed the CEO and the loan officer of a community bank in Sacramento, how to apply for the loan before you could apply for that. And of course, community banks who already did work with the SBA had a good pipeline, but they had limited resources, because as they suggested to me, the reason the banks had to give these loans, and it's a point of frustration, is because the SBA did not have the capability to issue these loans like SBA loans, if anybody ever applied for them. Very few people did, but those who did, there are community banks that specialize in those. They knew the SBA, Congress knew the SBA could not do that, and so they had to rely on the banking structure, and it took a long time to get the rules down. And I think one of the main reasons is the banks were putting the money out there and it was going to be forgiven. And what are the rules on how do we forgive this once it happens? And people are still waiting for the money. So what you have, and everybody knows it is better than me that might have applied for it, is that the day after you got an order, you didn't have any revenue coming in the door, and you laid off your staff. You laid off your workers. And here we are a month later, and most people haven't gotten any money yet. And even if you did get money, can you get them back when you don't have any revenues? Does it make sense to hire everybody back? Which is the goal of the Paycheck Protection Plan, is to pay the workers. Does that give you any revenue as a business? No. That was never the goal of the Paycheck Protection. We hear all these talk about how the small business needs it. They may, They may be a lifeline, but in the end, the Paycheck Protection Program was about hiring workers regardless of whether or not you had any revenue. And you didn't have to show you had revenue. All you had to do was show that you spent 75% of the money on payroll. And for many businesses, their workforce is gone. And they're collecting unemployment at $1,000 a week. And if they're in support roles, they may not want to come back to work if they can collect a similar amount. So everybody knows those are the challenges, and those are the challenges with doing this after the fact and trying to get out $1 trillion in loans to businesses. So I'm going to come back here a second. I think this is important for everybody to realize, is that whatever Congress did, which is, you know, to me, fiscal policy, here's money in your pocket, we're going to give everybody $1,000 or $1,200. Or what the Federal Reserve has done in terms of monetary policy, they're increasing liquidity. They have a loan program that does not forgive for businesses with over 500 employees, for medium-sized businesses, which is really the bulk of the economy in terms of velocity of money, but it's not forgivable. Those loans are available through what's called the Main Street program. Both of these programs are bridges, and let's be clear, they're a bridge until we can open up the economy, as everybody out there who knows who's having trouble getting revenue, until we can open up the economy so that businesses can get revenue back. There's some businesses, I mean, the irony here is with the PPP is that you can pay your employees, but you have nobody coming in the door. And that certainly is the case for a lot of restaurants, and you can keep your kitchen staff working and maybe do some takeout, but depending on what kind of business you had before the crisis. But hotels, hospitality, movie theaters, all these kinds of things that that can't have revenue is the problem. And these programs, whether they the monetary policy from the Fed or fiscal policy from Congress, are really, I don't view them as stimulus as much as I view them as a bridge, because the stimulus will only come when you can open up your business and people can come to your business and spend money. So what we're seeing is that people are spending their income, whatever they have. Now let's be clear, you know, 70% of the people are still working. So, but a 30%, 20 to 30% of people who aren't is huge. And the people that are working aren't necessarily spending money on discretionary products. They're not buying cars, they're not taking trips, they're spending money on the essential products, first of all, because that's all that's open, and two, they're concerned. And so I think this really important aspect of this for everybody to recognize is that, yes, there are people, you know, who would probably go to Disneyland if they open tomorrow, but they're not going to do that because they know that's not safe and people would come, but they're working on a plan. But there's a lot of people who aren't going to utilize your business until you can show them it's safe. And so there's two aspects of this in any economic analysis: supply and demand. And supply is one thing that you may provide, but you know, if people don't feel like they're safe and you can't show them that you're going to be safe, then I think that's a concern to them, and they're still not going to go out even though you may be able to open up for business. So let me come back to one of the things you asked about, and I think this is really important. How do we get to a situation where we can encourage people to open things up? And, you know, like I said, there were some local communities who asked the governor to let them be in control, and he has not agreed to that yet, but I think they're looking at that. It's a good roadmap for being able to get the governor's attention, but most importantly is very significant in terms of being able to find a solution in your communities. The lobbying has to be done at the supervisorial level in conjunction with the public health people. I mean, it depends on your location. You know, if you take your public health person to the food bank, you're going to see that the lines are, down the street. There are public health consequences to not being able to have a job, severe public health consequences. And I think our elected officials need to engage in that, find that right balance. And that's where the lobbying needs to be right now, I think, with your local elected officials, to be able to get them to appreciate you can do something safely. You can do something that's not at risk to the general population, the customers, your clients, your patients, whatever it is, if they will encourage the governor to open up and work together. Eventually, and I've always felt this way, that the governor was apprehensive about all of this, having a huge impact on the ability for the state to deliver services. And, the longer this goes on, the more we're going to see governments who, we saw the most recent, the bill, the congressional act that the Senate passed, but the House is still waiting to do, has more money for governments. And I think the governments are just like businesses now. They're becoming to realize that, we're going to have to lay people off. We can't deliver the services, just like businesses can't deliver the services to their customers. And when you have a specific impact on you, I mean, if the first 3 or 4 weeks, it didn't matter, you were able to deliver your services, you weren't as empathetic. I think we're seeing the government becoming empathetic, and I think the governor is empathetic on this, because you're going to be in the same boat as businesses.
Alan, I want to ask a question, kind of follow on, and that is, the governor's been in his role for 2 years, and I know you made some pronouncements after he was elected. Hey, we're looking forward to working with him. We look forward to working with him, and we'll see how it goes, knowing how he's governed in the past. And knowing that he's listening to the regulators that you mentioned, how is he doing as a governor leading during this crisis? And are there things you'd like him be doing differently?
Well, first of all, I think all leaders are eventually evaluated on how they handle a crisis, whether it be I would say, Jerry Brown, the second Jerry Brown, 2.0, was took over in a fiscal crisis, and he raised taxes, but when he left office, he left a surplus of $20 billion. And I think historians will look back and say Jerry Brown handled that economic crisis, did what he needed to do, and held the line on spending for the most part. Pete Wilson, when he was governor, had issues with floods and an earthquake in Northridge. And if it wasn't but for Prop 187, Pete Wilson would have been remembered as the governor who handled wildfires, crises, and earthquakes. But Prop 187 pretty much overshadowed much of that, for better or for worse. So I think what you're asking is a very good question about how we evaluate our leaders, especially in terms of crisis. You mentioned I was in the Air Force. It's not how you land the plane when the sky is blue and the wind is 5 miles an hour right down the runway. It's when you're in thunderstorms and you have a 20-mile-an-hour crosswind. Those are where you can really test, is it a good pilot or not? And in the same way here, how do we test the leadership? It's not when the sky is blue and the wind is right down the runway. It's when we have a crisis, when we have thunderstorms on the runway, and how are you doing? So just to lay that out there, I think this is for anybody who's a leader. There is no roadmap for this particular crisis. You can prepare for earthquakes. They're still going to be devastating. but I don't think anybody ever prepared for this particular crisis where government, I think this is where government shut down the economy to prevent the spread of the disease. And that's what's happened here. And I think the governor is doing a good job, and a job that would be difficult for anybody. I can't imagine there is anybody who's a leader who wouldn't have difficulty with this particular response to dealing with this, because when the solution is to shut down the economy and take people's livelihoods away, how do you correct that? And so you start with the public health aspect and making sure we have enough beds, and I think that was his number one concern. But I think it's shifting now to testing, to the economy, and what are the consequences to the people. So having said that, so, you know, one of our positions, and I think I feel very strongly about this, as we all should, is that the safety net needs to be government coming back the other way. The safety net can't be the people who are on this call that may be businesses that are struggling to get revenue. The safety net has to be the government. And, you know, whether it, you know, be unemployment insurance, whether it be the paycheck protection, whether it be how you deal with regulations, you know, in many respects, the safety net, the backstop should be the government. It can't be businesses who are struggling to stay in business. And those are one of the messages that we've presented to the administration. This is where we want to help the government be the safety net, not just to help the worker, but to also help the business, and to make sure that they have the ability to be around when this crisis ends.
Hey, Alan, it's Mark here. With that being said, and well said, by the way, but are you aware of any programs at the state level, and can you give us some details on those programs and how they might roll out and help the small businesses?
Well, you know, the state government's in a different situation than the federal government. Mm-hmm. And I'll come back to what the state government can do in a minute. But, you know, the federal government can create money. Your local governments can't do that. The state government can't do that. They have to balance the books. They have to, you know, sometimes they can do cash flow money and borrow money, but they eventually have to have a path because they can't make money like the Federal Reserve. Having said that, what can the state government do? And the most important thing that the state government can do is work with local officials to make sure that we can mitigate the risk, we can care for the people that do acquire the virus, we can provide the right hospitalization, we can provide the right treatment for them, we can provide the right protocols. But the key right now will be they can't provide businesses with resources. What they can do is provide businesses with opportunity. And I think that's what the important aspect is. And the governor created this task force on the economy, but I think we continue to work with the members of the administration, just like we did before the task force was created, to be able to do exactly what I think is going to be the only way that the government can help businesses is to let them reopen. Are there things like tax credits that they can do? Are there things like retention credits that you can do? Yes, I think we've seen that in the past, but you know they're not a lifeboat. They help on the margin, but what the government can do mostly is find a path to be able to give everybody who's on this call and everybody else who's a member of the chambers an opportunity to go back into the economy and create revenues and create products and services that people can utilize.
Well, as we talk about the CalChamber and local chambers, since you mentioned chambers, what do you see as the role that local chambers can play in the recovery process?
Absolutely. And I think whether it be at your county level or your city level, I think this is really important to be able to show that what are the consequences to a shutdown. I mean, what are the consequences? You know, and we find this. So I know many of you have hospitals. You know, and you know, you would think that all the hospitals and all the medical care is doing well because they're treating patients with the virus. Elective procedures have been eliminated. So really what generates the revenue for a lot of healthcare facilities are elective procedures. And I just use that as an example of everybody's feeling the impacts of this. There are very few people that aren't. And so in terms of that, what can local chambers do? I think to make sure that their elected officials take control of the situation, work with the public health people so that they find that middle ground, that balance between how do we protect the public health and how do we make sure that people aren't relying on the food bank for the next 6 months for where their next meal comes from. I mean, I think one of the things that you know, everybody who's in the chamber world turns around and looks at the schools and should look at the schools is that's our future workforce. How are they going to be educated? Do we have a role to play in that? Can we work with those school districts to make sure that they have the proper tools to make sure that your children in your community have not lost an entire year of education? And that's crucial for them, and it's crucial for our future workforce. So that's, you know, just as an aside, what can you do? There are so many things that are so many issues that, and this is why in one of my comments to this task force is about chambers who aren't eligible for the Paycheck Protection Program. But the key factor being is you pull together leaders in the community, and the local communities are what develop community programs, support the not-for-profits, support the charities, support community involvement and engagement and civic involvement. Without a strong chamber, without a strong business community, that's the leadership that the chambers provide. But I think I'll come back to the most immediate thing is to make sure that the elected officials know what the consequences are. They see it on a daily basis. You help them understand what's going to happen to their budgets, to their staff, to their ability to do essential services in the long run. If they don't work with you and the governor to open up the economy, I said, I don't think it's going to fully come back until we have the ability to have public contact, which to me is obviously a matter of science. But if we take the mitigation measures that we have today, which include distancing as the #1 mitigation measure, if you can show how businesses that aren't included in the essential category can operate, and I would say this is one thing to invite each business to say, do you have a plan? And funnel that through the chamber so that the supervisors and your city elected officials see that, and they can work with the county health people to be able to say, let's petition the governor, let's petition our supervisors, let's open up these businesses that aren't considered, quote, essential, but are essential to all the workers, essential to the owners, and essential to the economy. And I think one of the things that's important to be able to point out to, you know, we're essential to the revenues that the government's going to need to be able to provide services in the future. And so I think that's the role that the chambers can play.
At the very beginning, we talked about the CalChamber has been a great resource. How do you see CalChamber working with and supporting local chambers in this process?
Okay, there's a couple things. I mean, I think a lot of businesses, you know, when this first started, and we've seen our helpline, our employment law helpline was inundated with calls. And I think that was in the beginning because I had to lay off my workforce. I had to lay off 70 people. How do I comply with the WARN Act? That's where you have to give, 60 days notice. I don't have any revenue coming in. How do I do final paychecks? Those are all the things that we've put out a lot of material so that businesses know how to deal with this situation and how to make sure that they don't violate the law. We've also petitioned, in many respects, the governor's office for relief on the WARN Act. The governor changed the time frame to notify people when they no longer had to have the 60 days to provide the notice. How do you do the final paycheck? These are things that are really crucial. There are things that one of the things that we asked the governor's office to take control of was to not have any new regulations until the governor lifts his emergency order. It's hard enough to provide input when times are good. It's almost impossible when your business is not fully staffed and is trying just to stay alive. So there are a lot of things that you will hear about. And I think it's always important to take the message that we've said is we as businesses are not the safety net. That's the role of government. So the governor's office right now is, and these are really well-intentioned as to whether or not somebody who, for example, who's a frontline hospital worker, if they contract the COVID-19 virus, do they have to prove that they got it on the job? And I think the governor is sensitive of that, but the original order that they were considering was overly broad and would have been a burden for everybody's workers' comp rates. So these things come up every day. We try to be able to inform people what's going on. Sometimes we are involved, things are turned around immediately, but there's 100 decisions every day that happen in the administration. And so Matt made a comment, let me just, expand upon that. When he started off about, well, we engaged with the legislature and that's a job in and of itself. Well, the legislature isn't around right now. And I don't know when they're.
By the way, Alan, we think that's a good thing right now. we want to lobby and advocate for a part-time legislature moving forward.
There's a couple contract lobbyists that might disagree with you that make their living off of that, but I won't disagree with you, Matt. But no, things are. But what we see is a vacuum, and the legislature really is not around. They're not engaging in legislating, and I appreciate that's probably good news to a lot of people, but that has left a vacuum in terms of governance, and the governor has stepped in and filled that role. And so there are things that come up every day, and whether it be us asking for relief from regulations or whether it be unions who are saying, we have this agenda, don't let a crisis go to waste. How can we get our agenda adopted by the governor through an executive order? And we fight those on a regular basis. Some we have time to include local chambers and other business groups, and sometimes we just have to deal with them as they come up. But I think every day we find this. But I think most importantly, this comes back to your original question. And that's, how do we get the economy restarted? How do we get people to be able to open up? And I think to embrace, I think we want, I think also your local officials, but we want the administration here in Sacramento, the state administration, to embrace ideas that come from businesses that say, we weren't included in the essential business list, but we can operate safely. We can provide a service, we can generate revenue, we can generate jobs, and we can do it in a safe manner that doesn't jeopardize either the customer or the worker, and doesn't put our hospital system at risk for being overloaded.
Alan, I'm gonna shift gears a little bit. I want to get this question about workforce in that I've been thinking about. You know, we have millions of workers who are now displaced in California. I got to think that many of these jobs are not going to come back. There's going to be a new normal. Some of these industries may not recover for a really long time, but we also have, you know, thinking forward, you know, a lot of high demand jobs, you know, whether it's in IT or telemedicine or nursing. Is there a workforce development initiative or something the CalChamber can be pushing for some type of workforce rapid retraining program or initiative to help displaced workers obtain better economic security moving?
Well, you know, that once again, these are good questions, and I think you know, what would be the program, and where would it be generated, and would it be generated at the, let's say, for some of these training programs at the community college level? And the reason I say that is because this is going to be community by community, and you know, whether or not you have the jobs. So let's take, for example, you know, in this parts of the Central Valley, you know, in Dinuba, are there going to be a lot of IT jobs? Even as we go forward, even though there may be a new normal, well, there may be warehouse jobs, there may be delivery jobs, but are there going to be IT jobs? Whereas in your community, will there be more IT jobs, heavier concentration? Do we have to have better access to IT services for the average person? I think it's going to depend on community by community. It doesn't do any good to train somebody and not have a job for them. And this is where workforce, and we've had these discussions, we had these discussions with the Labor Secretary, Julie Sue, and the WICS before this crisis happened, that you have to listen to the employers in order to have an effective training program, so that you don't train based on, well, my faculty knows how to teach this. That doesn't do you any good unless the employers in your community have jobs for those services. And so you have, I think that's one of the challenges, whether it be CSU or community colleges, to teach beyond your comfort level, to create programs that match up with the jobs in the community. Give you a good example, even though this is a private school, the University of the Pacific, which is based in Stockton, opened a Sacramento campus, and we had a discussion 5 years ago. Healthcare is a big deal in Sacramento. They created a nurse practitioner program in Sacramento, and they were overwhelmed with applications. And most importantly, to this point, they went out and recruited a faculty that didn't exist to be able to supply that need. That's what I think is what's important in the community college and CSU level. When you have those kinds of training, you have to go beyond your current faculty to match up with what the employer's needs in the community. So you asked me, you know, I think maybe the crystal ball, what is going to change? Well, I think we've already seen it. We have more delivery drivers and we have more warehouse people. I don't think that's what you're talking about. I think you're talking about what kind of skilled jobs are we going to have in the future that we need today. And this, you know, where most of your communities are, you have a skilled workforce that can develop that, can adapt to that. Many parts of the state, we don't have, you may be able to train people, but they don't have jobs for that. And I think that's the things in your communities that you have that many other people don't have, is the jobs to meet the demands where you can deliver services, you know, electronically. You know, I've, for better or for worse, I had a couple back issues, and I've done 2 consults over FaceTime, and, you know, both back surgeons said, telemedicine's better than no medicine, but telemedicine's not as good as being able to being really able to examine the patient. So there's things that are good that are going to change, and there's things that aren't going to change because they were working pretty well before. And I think change because the government said you can't operate the way you used to operate is not necessarily the best way to have change. The best way to have change is to say it's better, it delivers the services more effectively, more efficiently than we did the old way. And I think we will see some of that without a doubt. Will everybody work from home? Experts say maybe 5% of the workforce. We had 10 to 15% of our people already working from home because their job allowed them to work from home. It was perfect for them. I don't see that expanding significantly in the future, but I think for companies who never let their workers work from home, and government was certainly one of them, we're probably going to see more of that. But then, of course, you need to have support services that support them. So we figured out how to do, for our 115 employees, be able to make sure that our IT can deliver services. But I think that's where are the new jobs going to come from because of this? Well, it can't just be delivery and warehouse people because we don't have retail establishments anymore. So I think we want to continue to have certain things that provided a source of community for your local communities. Yeah.
Alan, we're getting a little close to the ending time here, but I do want to jump in with a question that kind of came online from one of our members who runs a very successful small to medium-sized business here in Silicon Valley. And he's concerned about, look, all these legislators, they all still have jobs. They're all still getting salaries. Yet they're all getting paid. They haven't taken a pay cut. They haven't been furloughed. And as we look forward, we're going to go into an economic recession. So city, county, state revenues are going to go down. What's the CalChamber's position on looking at the state budget and where should pressure be applied to make reductions in, the state spending?
Well, let me come back to what I said before, because I think it's a really important message for all of us to deliver, and that's the safety net has to be government, and we have to deliver that safety net. It can't be the businesses, and I think I'll paraphrase the question and I'll turn it around the other way and say, somebody's going to ask the question is, I laid off half my workforce. How come the government isn't laying off half their workforce? Their revenues are down. I don't have any revenues. Their revenues are going to be down. What are they doing to manage that? And I think we're going to see that. I think the governor appreciates that, knows it's going to happen. I can't say that every elected official in your communities realize that and know that, but you're going to get the point where if you don't sell any cars, you don't generate any sales tax, you're not going to be able to support your government essential services. And so in terms of what the business person in your community asked that question, here's the difference is that you as a business person, your revenues fell off the cliff the next day. The government has time to make those changes, but I don't think there's any question and answer to it. We're going to see, and I think this is where many people should be concerned about is, are they not going to manage their expenses and just try to raise taxes so that, and we're going to see that there's a measure going to be on the ballot in November to increase everybody's property taxes with a reassessment. And that was coming before this crisis. So I think we have to guard against that. I think that's there's just no magic wand for business, as there is no magic wand for, for government as there is for business. When your revenues fall, you need to match up your expenses with those revenues, and that's what we're doing.
Alan, if I could jump in, just probably the last question here. You might be familiar with AB 828 that looks to force landlords to reduce rents by 25%. Can you speak to that, and where does CalChamber stand on that?
Well, the legislature is not in session, so I'll just suggest to you that the governor issued some orders about evictions, but I think we're opposed to the initiative on the ballot in November, which is rent control. We think that the more you suppress the ability to get rents, the more you inhibit the ability to have affordable housing. And so we're opposed to those kinds of rent control measures that are going to diminish the incentive for anybody to invest in housing. I think I'll give you a good example, and this has happened in the Bay Area, where some local governments had said essential services for construction only apply to affordable housing. Well, it's no less safe to build housing that wouldn't consider to be below market than it is market rate housing. The health issues are the same no matter what. If they exist, they exist. If they don't exist, they don't exist for everybody. Building housing leads to affordable housing for everybody. And so we need to build more housing, and an inability to do that, which is what these rent control measures do, is going to lead to less housing. And that's exactly contrary to, in conflict with what our elected officials say they want.
Well, thank you, Alan. I think we're at our time. Matt, any final questions from you or any comments?
No, I'd like to be respectful of everybody's time, but I want to thank Alan for joining us. Really appreciate your comments and your perspective. You've been through a couple of these cycles, and this is uncharted territory for so many of us, including yourself. So we appreciate your leadership from the CalChamber. Also want to thank Mark for asking you to do this and being a co-chair with me of the Silicon Valley Chamber Coalition. It's my pleasure to work with Mark. Really appreciate that. Last thing is, I know our chamber, Gilroy Chamber and the SBO both have information about COVID-19 resources, information, tools on our websites. Go check those out. Also, we have a webinar. The SBO is doing a webinar tomorrow with San Jose City Police Chief Eddie Garcia. Tomorrow, I believe at 2 o'clock. Encourage people to sign up for that. He can give us an update on what's happening in the city of San Jose and regionally. There are impacts to public safety as it relates to what's happening with our corrections system and inmates being released early and things happening. Phenomenal police chief, by the way, and he's a guy's guy. So it'd be great to hear from him, and hopefully you'll join us for that. But Alan, thank you again. Appreciate all the work that the CalChamber does, and Dave Kilby on behalf of the Western Association of Chamber Executives as well. Really appreciate you being here with us. And with that, I'll let you wrap it up.
Thanks for the opportunity. Good to talk to you. Great.
Thank you, Alan. Thank you, Matt. And thanks everybody for joining us. Have a great day.
Right. Thank you very much. Thanks, Monique.
Thanks, Matt. Thanks, guys.